Hello, my name is Chris Liu. I am a GI medical oncologist at the University of Colorado Cancer Center. Today I wanted to give you an update on the recent advances in colorectal cancer research that was presented at the American Society of Clinical Oncology, or ASCO, annual meeting held in Chicago, Illinois. At this meeting, over 30,000 researchers, providers, and patient advocates came together to discuss the newest advances in cancer care. One of the largest studies in colorectal cancer was presented in the main plenary discussion session of the meeting. Dr. Alan Vanook from the University of California, San Francisco, presented the CALGB SWOG 80405 study. This study began in 2004, and it studied the effect of bevacizumab or cetuximab, two targeted therapies for metastatic colorectal cancer, in combination with chemotherapy, and this was studied in patients that were previously untreated and had metastatic colorectal cancer. And in total, the study included 1,137 patients. All the patients were selected to receive chemotherapy, and this was either FOLFOX, which is 5-fluorouracil, leucovorin, and oxaliplatin, or FOLFIRI, which is 5-fluorouracil, leucovorin, and irinotecan, and this was based on physician preference. They were then randomly assigned to receive either bevacizumab or cetuximab. In this study, a majority of the patients received FOLFOX. Bevacizumab or cetuximab in combination with FOLFOX or FOLFIRI chemotherapy regimens showed similarly effective overall survival in patients with metastatic colorectal cancer, and these patients did not have a mutation in a gene called KRAS. The trial did establish a new benchmark in median overall survival for these patients at approximately 29 to 30 months, which is substantially longer than even 10 years ago when the trial began. For patients, what this tells us is that either FOLFIRI or FOLFOX with either bevacizumab or cetuximab are perfectly reasonable options for patients who are untreated and have metastatic colorectal cancer. I will stress that the remaining analyses of the study's data will shed more light on who might benefit most from these therapies. And importantly, this trial defined KRAS wild type, or no mutation in a gene called KRAS, based on traditional codons. And what I mean by that is mutations at codons 12 and 13. But in recent years, the suggestion has emerged that using expanded RAS analyses or looking for atypical RAS mutations could further select patients that would most likely receive benefit from the drugs. What I will call traditional RAS mutations account for approximately 40% of patients with metastatic colorectal cancer, but adding in various other genetic markers, such as atypical or non-traditional RAS mutations that are not routinely tested for, could exclude more patients from the analysis and may affect the overall results of the study. Along the lines of expanded RAS testing, another study was presented at the ASCO annual meeting looking at atypical or non-traditional RAS mutations, and this was in a European study called the OPUS study. And in this study, which looked at chemotherapy in combination with cetuximab, patients with the atypical RAS mutations that have not, again, been routinely screened for, appear to predict a lack of benefit from cetuximab. This means that the patients were receiving none of the anti-cancer effect from the drug that we want, but they were definitely receiving side effects. This study confirms the results of prior studies, and the combined data from these studies strongly suggest that we should be looking for these non-traditional RAS mutations to avoid treating patients that won't benefit from the drug. This is just a handful of data that was presented at the ASCO annual meeting. For more information, please visit the ASCO website at asco.org, and more information regarding colorectal cancer is also available at Chris4Life.org. Thank you very much.